There was once a day that I would pray for you. I'd go and misbehave just so you'd notice too. Sneaking looks up and down from across the room. And damn, what a hell of a view.
Each rose ceremony was difficult.
Just got out of a below-the-knee amputation. Good morning, it's Wednesday already today. Monday I had off because I had a doctor's appointment in the middle of the day. And these things on third year can be a little bit hard to schedule because every time you try to schedule a doctor's appointment or something during the regular work day, that's also when you're supposed to be at the hospital. So sometimes you do end up having to miss a day of the hospital, but it's always okay to ask, and if you need to go, it's always okay to miss a day or two. I'm on my way to pick up Alex for our commute to the hospital. I'm currently on my surgery rotation, Alex is on his OB rotation, and thankfully we're at the same hospital, so we get to carpool because our drive there is like 40 to 45 minutes long. Last week I got to see a couple of vascular procedures, and I didn't think that vascular was going to be as interesting to me as it was last week. Last week I almost became a vascular surgeon. I saw a carotid endarterectomy, and before that I saw an AV fistula get placed for dialysis. Something about the carotid endarterectomy, like the small window, the delicacy of the procedure, how understandable all the structures and all the layers were, and how the procedure went along. Something about it really appealed to me last week. So yeah, yesterday was mostly clinic day, so we were seeing the pre-op patients that were recommended that they go see a general surgeon to get a consult on whether they should get surgery, seeing post-op patients. There's one case that I got to go to yesterday in the OR, which was a below-the-knee amputation. So it was also done by a vascular surgeon, which first of all, I thought those type of procedures only ortho did, but it makes sense because there are a lot of big arteries running all the way down the leg that you have to control for bleeding for, so I assume that the vascular surgeon can cut through bone and tissue in the same way that an ortho surgeon could, but has a little bit more understanding of the vasculature and ability to control bleeding. And I joke about it, but the joke is that yesterday I unbecame a vascular surgeon, so on Monday I almost became one, and then yesterday with that procedure I think I realized that it's not for me anymore. Something about the carotid endarterectomy was so appealing as a procedure altogether, and then something about the below the knee amputation just was a little bit too like messy and big and there wasn't, I guess, as much attention to the little details as I like about the more delicate and small surgeries, which the surgeon still did a really good job of making it look really nice and making sure all the bases are covered and that there were going to be no complications with bleeding or anything like that. So he did a really good job. But to me, that's just the procedure as a whole wasn't something that I pictured myself doing for the rest of my life. Basically, now I think that vascular surgery is somewhere in the number 2 or 3 spot, and cardiac surgery is still number 1. But those surgeries were really cool to see, and I'm really thankful that I got to see them. So today we're back in the OR. It's a full day of OR cases, and it's going to be really fun because the schedule is very diverse today. There are a ton of ortho procedures that I still haven't seen, so I'm debating going to some of those, and there's also a couple of more of the like aesthetic cases. There's actually a liposuction today, which I don't really even have like a good concept of what a liposuction procedure is like. So I think that's going to be the first procedure that I'm gonna go try and see today in the OR. Liposuction started like 30 minutes later today, so I'm gonna go try and catch a lumpectomy, a breast lumpectomy first, and then come back for a second liposuction after. Last week I fell in love with vascular. This week it's plastics. I'm back from a day at the hospital. Today was such an awesome, fun day. I'm also watching the Yankees play Kansas City, and it's tied at 2-2. And rooting for the Yankees for Alex. But yeah, today was such a good day. I'm exhausted. Surgery, the days are so long and there's so little time to study, and I'm behind and I get home so tired and I still have to study, and like I keep falling behind more and more. But at the same time, I wouldn't want it any other way because surgery is so fun. And when you find the thing that you love, no matter how exhausting it is, it didn't feel like work at all today. It honestly felt like I just had the most entertaining day. Like I was entertained all day. I was having fun the entire time, and then I went home, and I wish the day could have been longer. So today was set up to be an interesting day because it was going to be very much like aesthetic in a sense. The first surgery that I went into was a breast lumpectomy. It was carcinoma in situ, so the cancer didn't infiltrate the basement membrane, so it didn't spread anywhere and it was nicely contained. They had biopsied already previously, and what they do is they put in a little clip and then they put in a little guide wire to guide the surgeon on the depth where that exact calcified tumor is. And so we watched the surgeon go in and take out a piece of tissue out of the breast, and then send it to radiology to make sure that he got enough of the tissue around the tumor, and then also cut out margins, send it to pathology, send the rest of the tumor to pathology as well, and then close everything up. And it was interesting because that led into us talking about the post-procedure care in terms of, do you get an implant? What kind of implant do you get? And will cosmetically, like how will it look post-surgery? Because they took out a good amount of tissue to where there had to be some sort of dimple or crease in the area of the breast that they took it. So basically that started that conversation on aesthetics. And then it was interesting because right after that I went to go to a liposuction with 2 plastic surgeons, and we did end up talking about reconstructive surgery as well. But the liposuction was really cool, and I was never interested in plastic. I never thought that it was for me at all, so I kind of went in just curious about what the procedure was going to be like, not really thinking that any of it would interest me. But it was such a cool procedure, and I think a lot of it is really about who the attending is, what the team is like, and what kind of vibe they create in the OR for you. Because I think I'm falling in love with these specialties because of the atmosphere in the OR and how like fun and friendly and just interesting the surgeon themselves make the procedure for me, or the day for me. So these 2 plastic surgeons were awesome. They were so fun to get along with. They explained everything so nice. They cracked jokes. Like it was just such a good atmosphere in that OR that I almost became a plastic surgeon today. And I said that about vascular surgery last week because the vascular surgeon that I was with was also really awesome. So the surgery that I watched today was for lipedema, and it's very interesting because lipedema is an abnormal accumulation of fat, and from what I've read, it most often occurs in the lower body. From what the surgeons told me and from what I read online is that even though it was discovered a really long time ago, it's very commonly misdiagnosed as lymphedema or just obesity. And so because of that, people would come to doctors and they would be turned away being told that they should just exercise and, you know, do the lifestyle modifications. But now it's been gaining more recognition as a diagnosis in itself and something that requires surgery or may require surgery. And so what they did is they did a liposuction of both lower extremities, and after that they pulled the skin together, they got rid of the excess skin, and then they sutured everything back. And I got to assist with a lot of the procedure because the area that the surgery took up, if you think about the entirety of both legs, was so grand that there was so much for me to be able to help with. So it was really cool. We just had some really good conversations about plastic surgery in general and the field. I don't know if I'm like 100% sold on it, but I definitely did not think it was going to be anywhere near my like top 5 if I had to rank my surgical specialties. And now I feel like it's like in the top 3. I gotta wake up early tomorrow because that same surgeon is going to be doing a liposuction with redistribution into the buttocks. He invited me to come and watch that as well. So it's going to be very interesting. All of a sudden I went from not seeing a single plastic surgery to just having like a plastic surgery full week. So yeah, I'm very excited. I don't think I'm gonna study anymore today. I did like literally zero studying today, and it's 9:40 p.m. and I have to be at the hospital at 7 tomorrow. So I'm just gonna finish watching the baseball game and then go to bed. Another great day of surgery today. Only got to go to one surgery, and I honestly went in thinking that it was going to take maybe at most like 3 hours, and I ended up being in there for 6 hours. I was with plastics again today because I had a really good day with them yesterday, so they invited me to see another procedure today. And so what we did today was an anterior and posterior thigh liposuction, and after that we took that fat and repartitioned it into the buttock area, which is colloquially known as a BBL. I like plastic surgeries. I think I definitely, if I were to go into plastics, I would do reconstructive plastics or something that is more disease related versus the aesthetic angle of plastics. This procedure was quite simple. A lot of it was just breaking up the fat, sucking up the fat, then cleaning up the fat from like the excess fluid, flipping the patient and putting in the buttock area, and then kind of making sure the shape was good, and then closing those sutures up, and then just finishing up the case. So pretty simple surgery, but because it was very repetitive and it took a while to break up the fat and suction the fat, that's the part that took a long time, especially because it's bilateral. And then after that I went to clinic, and it's 6 p.m. now. Clinic is also really fun. I like the way clinic breaks up the OR schedule, and it's nice to see patients after surgeries, especially if you recognize them or if you were in their surgeries and you get to see how they're doing now. So I really like clinic a lot, and I really just like all the attendings for the most part that I met here. Everyone's very nice, very generous with their time, very willing to teach, so I'm learning so much. And just like the atmosphere and the vibes that they create are always really good. Now I'm gonna go head to the gym. I haven't studied at all today. Again, I feel like I've said this entire week. So gym and then big study night tonight. I'm so tired. I've been trying to work on this UWorld 20 set for I don't know how long. Then I went to go take a shower to try and wake up, and I'm still so tired. I'm on question 13. So I think I'm gonna try and finish the rest of these questions in bed, and I know that as soon as I start doing these questions in bed, I'm gonna fall asleep. I got some shoes for indoor soccer. The last time I played in my sneakers and almost rolled both my ankles. Really cute. From Puma, if you couldn't tell. I just came out of an 8.5-hour surgery. fully scrubbed in. This is me after 8.5 hours of standing. I feel like I had to relearn how to walk after that. This is my reward. This is lunch and dinner combined. It's 8 p.m. and I'm finally leaving the hospital after getting here at like 8 in the morning. And I went into this case. It was a pancreatic tumor, so it was pancreatic cancer. I was scrubbed into this case for 8.5 hours with no food, no water, no breaks, can't go to the bathroom, nothing like that. And honestly, it was fantastic. Like, this was longer than an average person's workday, and I spent it all in one tiny spot pressed up against the OR table, helping with my little things. I feel like there's so much ample opportunity to complain, and I feel like I see so many medical YouTubers literally complain about every little thing like that, about how the day is long or how they were stuck doing something for so long and they didn't want to. And it's so much of it is about how you look at it and how you paint it. And it was such a long day, but it was such a good day. I learned so much. I got to, like, I feel like I bonded with the whole team because we were all at that table for so long. Like, there's so many positives that you can take out of something like this. And that's exactly how I'm looking at it. I literally have no complaints. I just hate, like, it's such a big pet peeve of mine when I hear people complaining about things that you could just turn in your head and make it positive. But aside from that, it was such a great experience. We went in not knowing that it was gonna be so complicated. Basically, all I got from the patient chart and from talking to the team was that it was pancreatic cancer. It was a tumor. The patient had already undergone chemotherapy at some point. The tumor was being monitored, and so what we were going to do is originally go in laparoscopically and see if we'd be able to resect it out that way and then potentially convert to an open. And we ended up having to convert to an open because the tumor ended up so fused to the splenic artery that we couldn't peel it off, basically. And it was so interesting to listen to the surgeon's decision making because it was between trying to get it out laparoscopically versus if we did an open procedure. Apparently, then the patient can't go back to doing chemotherapy for multiple weeks, which I didn't know about. And so obviously that delays patient care. And if we open it and realize that we can't actually resect the tumor, then we are delaying her care and we didn't take the tumor out. And so from previous CTs, they could tell that it was around the splenic artery, but they couldn't tell if it was infiltrating or if it was just around. When we went in laparoscopically, we decided that there was a chance that it wasn't invading because we could peel off the tumor a good amount, like a couple centimeters off the splenic artery, and then he made the decision to basically give her the chance, try to resect the tumor through the open procedure. So we opened and began resecting, and oh my gosh, that tumor was attached to everything. Like, cancer is so awful. It engulfed so many different structures. So every time we thought that we got a piece of it off, it was surrounding the SMA, and then it was surrounding the IMA and the IMV, and then it was literally just everywhere. It was attached everywhere. And on top of that, when we started the case, he was talking about how the splenic artery being infiltrated by the tumor isn't uncommon, but what's actually uncommon is when the tumor infiltrates into the portal vein. And he was like, that is really unlikely. And guess what happened in this case? It infiltrated the portal vein. I couldn't believe, literally he said it, and 30 minutes later we were like, no way. And so we actually had to call vascular surgery. And so I saw my vascular surgeon that I really liked from 2 weeks ago, and he came in, and so both of them were working on getting the tumor out of the portal vein and sewing the graft in. It was crazy. It was so much work. I really applaud them for that. This is why I hate cancer. This is why I didn't want to go into a specialty that had a lot of cancer in it, because it's so hard to handle. And when they got to the retroperitoneal space to see how far the tumor extended posteriorly, they realized that it was encompassing the renal vein as well. And he actually told me that Oftentimes with this type of surgery, they actually end up taking out the adrenals. I assume it's because of the tumor infiltrating that as well. Honestly, it was a pretty hectic surgery, so I didn't ask a lot of questions because things were moving really fast. There was a lot of bleeding. The tumor bled so much. There were times where like the little wells that they made would completely fill up with blood, and we had to like pass instruments really fast. I got so good at learning the names of all of these different instruments today because of the pace. I was helping the scrub nurse get things and pass it. The ligature, the DeBakey, the Bovie, the suction, just like back and forth. But yeah, I left and they're still going, and I don't know how much longer they're gonna have because I wanted to stay at least until the tumor got taken out, because I wanted to feel that feeling of like, we got it, like we were here for this long, we got the sucker out, and I just couldn't make it that far. Now I gotta go home and I gotta study, and I'm already a little behind from this weekend, so like I just, as much as I wanted to and I feel like I could keep going at least for a little bit, I just feel like I just can't afford to, because like as a medical student you also have to find study and time to study, and technically you're a student first. So like when I was talking to them and they were like, have literally no worries, like you can leave this procedure whenever you want, and the surgeon literally said, you're a student, this is not like, your priority is not to be here for 9 hours, your priority is to like study and pass boards and do well. And so yeah, and so I left and they're still going, and I am like, I really applaud them so much for this. But also on that note, I'm so proud that I made it for this that long. Like I had no idea that I could stand there in one place with no food and no water and be fine. And I feel like I just like proved it to myself that I could do it. Like if I have to do it, I'll do it. And as someone who really wants to go into surgery and go into cardiac surgery where procedures can take 4 to 6 hours, I don't know, longer maybe, I'm so proud to know that I can do it. Literally my only complaint is I just get lower back pain. Like that's like the worst thing. Everything else was fine, but my back gets so stiff. Like my quadratus lumborum literally at some point like couldn't take it. Seriously, such a great experience. And also, I don't know if I mentioned, but my elective is coming up, and I originally was going to do like extra weeks of internal medicine to make up for my failed internal medicine rotation, but I decided that I was going to do surgery instead. So I basically extended my surgery rotation by another 4 weeks, and I couldn't be happier. I feel like that's exactly the place I want to be, so I don't think I want to do anything else. So why not do what I love for 4 more weeks? That's it.
When motivation is low, it's time to bring out Rochelle so she can motivate me to finish my U-roll.